Hi, everyone. Thanks for joining us for today's ClinicTracker community training series. My name is Alicia, and I'm one of the product experts here at ClinicTracker. Today, we'll be talking about the campaign builder and how it can help you engage with your clients and more. Okay. Before we get into today's topic, I do like to remind everybody why we have these webinars. We do have them so that you can make the most out of your clinic and billing tracker system. We also want to make sure that you get the answers to the questions that you have. So we do open the floor at the end for an open question and answer period regarding any system related items that you might have. Okay, sometimes it's helpful to come and ask the question at these webinars so that you can hear from other clinics how they're doing things and also perhaps give us ideas on how we can make the system better. Okay, because we're trying to make these webinars as helpful to you as possible, we do ask that you submit your webinar suggestions as frequently as possible. So if you're running into something and you submit a webinar suggestion, we love to hear that. We'll get it on the schedule. If you want to submit 2-3 suggestions a week, that would be great. We love to hear those suggestions so we can train based on what you all need, not what we think you need. Okay, that being said, we'll get into today's topic. As we go into today's topic, keep in mind that it is my goal to make sure you have as much information and understanding about the feature I'm about to show you as possible. So you can help me with that goal by asking questions as we move through. Okay, so you can ask those questions by raising your hand, and I'll unmute your microphone if that's easier for you than typing. Okay, if it's easier for you to type out your question, there's a questions box, and I'll be keeping an eye on that throughout the webinar. Okay, that's just gonna, and that will help me answer your questions as we go through and make sure that everybody gets as much information as they need about the features in ClinicTracker. Okay, last thing I'll mention before we dive in is that these webinars are recorded, so you're going to be able to reference them later and send them out to people who you think might find them helpful. Okay, now one of the things that we're going to get into with the campaign builder is how we can improve client engagement and use this tool to kind of create campaigns. We can also use it to notify the patients that perhaps a staff member is sick today, and so they'll need to contact the office to reschedule their appointment. So I'll walk you through how to access that campaign builder. Before I do, I want to also mention that with client engagement in mind, we've also made a lot of enhancements to our workflow builder. So if you haven't had a chance to attend any of the workflow builder webinars, I would highly recommend that you check out those recordings. If you can't find those recordings or you just want help finding them, please reach out to the support team. They're happy to send you the links. Okay, without further ado, we're going to access the campaign builder by going to utilities. Okay, and then we're coming about midway down campaign builder. So utilities, campaign builder. Pretty easy, utilities, campaign builder. Once you're in here, what you're gonna see is the ability to start what we call a new campaign. Okay, so what we're doing is we're gonna start like a new message that's gonna go out to a number of users all at once. So let's use our clinician call out as our example. So we'll say this is clinician call out. Okay, and then we can say what date and time to send. So it can be today, later today. It can be on a certain date. So if you're just getting this campaign ready, you're getting ready to start a marketing effort in the next few months. You want to get your draft started. We can schedule this out. Okay, we'll leave this as today for now. I can say the communication method. So I'm going to say this is an SMS. This is a text that I'm going to send out to everybody. I could also say it's a voice call and an email or any combination thereof. Okay, any questions so far? I don't see any questions, so excuse me, we'll keep moving. sorry, I thought I saw a question coming in, but it doesn't look like it. Sorry, I'll keep moving. Okay, so here, when we select the type of item, this is going to be based on what you have available in your system. So let's say that your system isn't enabled for voice calls because you've selected just not to make that an option. You wouldn't want to have those voicemails going or voice calls going out as your notification that a clinician called out, because your clients are accustomed to doing or receiving texts. So those are the kinds of things you want to keep in mind as you're building your campaign. What kind of communication have I conditioned my clients to be kind of used to from me, and we'll kind of follow that same pattern. Okay, we'll keep moving with this example. Here we can say, how are we going to start this message? Are we just going to say, hi, Hector, or are we going to say, hi, Hector Jones? Okay, so we'll say, hi, Hector. So I just kind of double click the first name. I'm going to go right before it and say hi, and then I can put my comma afterwards, and I can just start typing out my message. So it says, hi, Hector, and I can say that, you know, your provider, oops, is sick today, and you can fill out your message here, you know, contact us to reschedule. Then for the email, you'll need a subject line. In this case, we're going to need to add a test phone number to test the campaign. So we'll put in our test phone number here. Okay, and then we can also put in a test email if we were sending in a test, or excuse me, an email. Okay, pretty simple for step one, I think. Any questions on step one? Okay, I don't see hands up. I don't see questions. I'm just going to pause in case anybody's taking notes on step one. Okay, going to move along. I don't see questions, don't see hands up, but please do feel free to ask questions. If you have a specific scenario you want me to, or example you want me to walk through after this, go ahead and put it in that questions box, and I'll be sure to walk through any scenarios we have time for. Okay, continuing along, step two. We need to pick the patients, or excuse me, the people that are going to receive this message. So in our case, we're looking for patients who have an event scheduled. So we're looking for active clients in our case. I only schedule for active clients. You may schedule for both. So make sure you're paying attention to this status. It's the client status that's coming from the demographics form. Okay, then you can select a specific patient group. In our case, we're going to just leave it pretty generic for the sake of time. We'll say all for all of these, but you can filter this out. So you know, if you're looking for a specific patient group to say, hey, we have a new program that's coming out that might speak to you. You know, that might be by patient group in your case, or it could be by program assignment. All kinds of things to think about here. In our case, it's going to be for all people, coming right down to events scheduled between. So we want to say anybody with an event scheduled today was linked to me because I called out. Okay, and I'm actually just going to open this up a little bit because we are in a demo system. I want to make sure we get some results. So I'm just going to open that up. But in your case, if it's a call out, if it's a true call out, it'll probably just be for today or maybe the next few days if the staff's going to be out for a while. Okay, we don't need to do diagnosis of or medication, but these are handy if you are starting a new program and it makes sense to market to certain people within your client base. Okay, next I can say populate recipients. So once I have my criteria filled out, populate recipients. Okay, this button over here, clear selection, that's going to wipe out anything you've done above and just let you start over. Populate selection or recipients. And you can see over here now in step 3, we have clients available. It's going to show me everybody, excuse me, that met the criteria I selected in my demo system. It's just the one. Okay, and then I can say, okay, this is the person who's going to receive or people who will receive it. Okay, now when I'm done at the bottom, I can go ahead and save the campaign. Okay, so it's just letting me know this active date, it's in the past, but because this isn't an active campaign yet, it's not going to be sent. So right now I'm just kind of saving this draft, and I'm just going to say yes here, that's fine. Okay, now it's just telling me I actually have to have appointment reminders enabled for this campaign to be set as active. So it's going to let me save the draft if you want to go in there and play around with it, just like I am. But I'm not going to be able to come down here and what's called activate or test the campaign until I have my appointment reminders set up. Okay, if anybody has questions on that, let me know. If you don't currently use appointment reminders and you have questions on that, we can certainly get you in contact with the right people to have that conversation. Okay, Patty, I see you have your hand up, so I'm going to unmute your microphone. Hi, Patty.
Oh, there. Back to the message content. There is a maximum number of characters you can put in here, correct?
So it's not a maximum number of characters, but that's a good point. There is a maximum number of characters that a text message will allow. So that is something to consider because you are charged per text message and that's based on your contract rate. And if you go over a certain number of characters, it might become 2 messages, which incurs 2 transaction fees. Does that answer your question?
Yes, it did. Thank you.
Certainly. Any other questions before I mute you again?
No.
Okay, happy to answer anything that anybody has. Great question. Thank you so much. I really do appreciate any questions that anybody has, anything that's coming to mind. No silly questions here. It just helps me know, number one, you're listening, people find this useful, and that you really are getting the info that you need. Okay, so just to kind of be really clear, we have just saved our draft, so save campaign, and it's, again, I'm just going to walk through it. It's just prompting me. I'm not going to be able to make it active. Okay, now let's say I want to come back to this later. I saved my draft. Oh, so let's just save it again. Okay, so let's say I want to go in there and access it. I can go back into the campaign builder and come down to load existing campaigns, and that's where I'll be able to access those campaigns. Okay. Okay, let's walk through one more example. If anybody has any questions, let me know. I didn't get any requests for special examples, so let's do a marketing outreach example. Let's say you have people in an intake status, people that maybe had contacted you long ago or even recently, but at any point in your history, but they never made it into an actual patient status for whatever reason. So we might say, if they're in an intake status and they're still active, maybe I didn't mark them as discharged as an intake. Maybe you mark them as discharged if they're just really, really not the right fit or whatever the case might be. Oh, Victoria has a question. Is there a limit to how many recipients can receive a message from campaign? That's a good question. I'm not aware of a limit, Victoria. So if you see that, if you could maybe send that into the support team, that would be helpful. I'm just not aware of a recipient limit. Okay, any other questions, let me know. But yeah, Victoria, definitely, I don't think there should be a limit there. Okay. Okay, so again, we'll say in my clinic on the demographics form, I keep people in an intake status if they don't make it in for follow-up treatment, they don't make it into like a client status in my world. Okay, and if I meet with the intake and for whatever reason I say this person cannot be seen here for whatever reason, I mark them as discharged. So that's my workflow on the front end. So that's how I'm going to set up my search for recipients. And I know I'm getting ahead of step 1, but I'm just kind of thinking through my example. Okay, so now I'm just going to say this is an intake outreach. Okay, and I can set this again to the future. In this example, I'm going to say, well, we're not starting this marketing effort until October 1st. I'm just kind of getting things ready and thinking about how things would go. This is going to be an email campaign. So I'm going to say, like, hi, first name, and then I can put in my content here. I'm just going to say XYZ. This might be, we haven't heard from you in a while. It could be anything like that. So you can put anybody into your system as an intake, and they can be on this list to receive email nurturing later. Oh, Patty has a question again. Patty, I'm going to unmute you. Hi again.
Is there any other message substitution fields?
Not currently, but if you had requests on specific ones that you needed, you could send that in to us. We're always looking for ideas to improve this because it's kind of a brand new feature.
And I wanted to let Victoria know there's no limit. It's just that it's a cost port. So if you have 3,000 people, it's whatever your SMS message cost is for each of those people.
Awesome. Thank you. I love it. People helping people. Thank you so much, Patty, for that. I'll go ahead and mute you again, but obviously if you have questions, I'm right here to help you. Okay, we're just going to keep walking through this example. This is my nurturing subject line. Again, I'm just going to, for the sake of time, XYZ. And then I can put in my test email. So this is going to be my email address so that I can make sure it looks good before I send it. So I just kind of put in something nonsensical here, but you get the idea. That's going to be your email address. Oh, Victoria, I see what you're saying. So Victoria had used emails and got a limit of 5 people. That could be because you're in like a demo mode, perhaps, or you haven't licensed the full module. Go ahead and reach out to support. They can check on the specifics for you. Thanks, Victoria, for clarifying for us. Yeah, if I can be more help on that, Victoria, feel free to reach out to me directly. Okay, so step 1, I'm through. Step 2, we kind of started already because I was thinking through it, but I told you my workflow, so I'm going to leave this discharge and intake. It's going to be for everybody, just everybody. So I'm going to say populate recipients. Oh, okay, and it looks like I don't, oops, I need to say active. Sorry about that. No wonder. Okay, and so I can come over here and select everybody I want to add, right? And put them in here. Oops. And I can add them into the list, okay? Oops. If I need to add additional people, so like you saw I started to press this button, so if I need to add additional people on the fly, so like here's everybody that qualified for the criteria, but now I want to add somebody specifically, like Andy here. So now he might be added in, and they can come over and find somebody else and add them in. So I'm like just manually adding people in as well. Okay, and I can say, you can see I'm right clicking and display demographics if I need to go fill out emails or anything like that. Okay, now I'm just selecting everybody on the recipient list, and that's where I can, save my campaign. Okay, pausing for questions. This module is really this simple to use. It's really this easy. So there's not a lot of complication here, and there's not really a lot else to cover. So we're very soon going to open the floor to any ClinicTracker or billing tracker related questions. It'd be helpful if you go ahead and raise your hand now if you have them. Go ahead and start typing them in if you do. I'm just pausing for any other questions about this module before we open up that floor. Okay, I think Patty, go. Okay, Patty.
I just wanted to let you know, I think this is very intuitive and very easy to use. And so we will be using it as much as possible. So thank you.
Thanks, Patty. Well, if you have any feedback as you're using it, we definitely want to hear that because, like I said, it's a brand new feature, and ClinicTracker is definitely for users by users. So, as we enter into using new features, we always want to hear from the people that are in it, using it day in and day out, and that helps us make the product better for you and better for everybody, really. So, thank you so much, Patty. That's really great feedback. I'll pass it on. Any other questions, feedbacks, way we can make this better for you? Are we not covering something? Is there a filter you need here that you don't see? A brand new product. Okay, so I'd love it if everybody could check this out after today and just tell us what's missing. What would make it easier? All right, Mariana, we have a suggestion. Is there an option to review all the messages sent for a campaign? So once you have the campaign sent out, you will be able to see a report of everything that did go out. Yep, great. Awesome questions. Great. I love the engagement. I really appreciate it, everybody. The conversation is just helpful, and it's what we want these webinars to be like. The clinics kind of talking to each other, giving use cases, giving feedback. It just really makes the product so much better, and it really helps us accomplish our goal of really, like I said, like for users by users. We really kind of stand by that. Okay, opening the floor to any ClinicTracker, billing tracker related questions at all. Okay, I haven't seen any being populated in there yet. That's why I keep kind of talking along. Anything at all, ClinicTracker, billing tracker related. Any hands up? I don't see any hands up. I don't see questions. Okay. So I don't think we're going to get any questions. I think we've reached the end. So I will let you know we do have a new webinar coming up. Okay, and we're going to talk about a very new feature in the form builder, which I think is amazing. It is using a control reference. This is one of my favorite new features because it allows us to pull information from places in the system into one of our custom forms, right? So if I have an assessment and it lists out a presenting problem, I can list that out on the treatment plan. But now, instead of just listing it on the treatment plan, if I make an update on the treatment plan, I can have it automatically update the assessment where it came from. Okay, so I can have it sync up both places. In addition to syncing up custom forms like that, you can also write back to some of the fields on the demographics form. Isn't that really cool? On the demographics form itself. So you're going to be able to update the client's demographics form from the staff portal if you have permissions, right through custom forms. So this reference control property is super cool. I really encourage you to come check it out. So I'm about to post the link. You'll see it's on July 8th, 1 p.m. Eastern time. If you can't make it, there will be a recording. Okay. Now I've talked a lot to kind of drag out to see if anybody's going to raise their hand or put any questions in, and I don't see anything. Okay, so please don't hesitate to reach out to us if there is a question, item of frustration, concern, anything like that. We're definitely here to be your partner. So please let us know how we can help you. We can only help you if you reach out. Okay, you can reach out on the phone. You can reach out through the support tickets. Also let us know those webinar ideas. We want to know if we can train you on something. We want to know how we can make this system as easy as possible for your end user. So just let us know what we can do for you. We're here to help. Okay, it looks like we're not going to get any more questions, so we'll wrap up for today. I really want to thank everybody for your time. It's really appreciated. And again, I want to thank everybody for the engagement, the questions, the comments, the helping each other. It's awesome to see. I just really appreciate it. And I hope we can build on this going forward with our future webinars. All right, everybody, we'll see you next time. Have a great weekend. Thank you again. We appreciate all of you.